and gentlemen, welcome to this new segment of your new program, Medcast. Medcast is your gateway to the latest medical updates and replying to the rumors we have in the society. Despite being sometimes behind the scene, however, their role is very important to us. Dentists are always having an important role in keeping our oral health healthy in our life. In addition, they also keep the oral health of our children as well, as it is important for their life, starting from day one of the childbirth. Today, we are honored to have the graduate of the greatest city of the world. From University of Liverpool, we have Dr. Rawan AlKhuwaitem, who is specialized in pediatric dentistry in addition to special needs. Welcome, Dr. Rawan.
Thank you.
We are so pleased to have you today as we are both graduating from the same city as well.
Yes,
Yes.
it's my pleasure.
It's my pleasure as well. Dr. Rawan, let's speak about the importance of the dentistry, especially in the children life, as some people think that the dentistry importance starts in the adolescence. So the first questions always come to the mind is when to start visiting the dentist and the early life.
Well, this is a very misconception, as you mentioned, and it's a myth. When I hear it that baby teeth are not important, we're not looking at their teeth now until the adulthood.
Yeah.
However, all guidelines recommend that child should visit their dentist when they are at the age of 1 or 6 months after eruption of the first tooth. So technically, by their first birthday.
So do we need a special care for the children's teeth, even if they don't have the teeth?
Well, when you take, first of all, when you take the child early,
Mhm.
you will detect any problems, not just on the teeth. Sometimes the mother is not aware that feeding a child from a bottle
Mhm.
can destroy the future teeth when it comes, or when they have only few teeth and then they're bottle fed and sleep at night.
Yeah.
This could affect them very harmly. And also, sometimes they have some habits like thumb sucking, for example,
Yes.
that could build problems in the future in terms of malocclusion and complications. So it's not about just having teeth, it's about assessing the child in general,
Mhm.
checking their milestone. Are they growing within their normal like limits or no? We can give the parents, educate them. Give them advices in terms when to start brushing, how often they should brush their teeth, or when they are, for example, having milk, they should wipe the gum, the teeth with a wet cloth. When they start teething, what advices that they should receive, because sometimes they only think that they need to put just the gel to
Yes.
ease the pain and discomfort for the child. However, sometimes only massaging with your finger or putting something really cold will help the child be more relaxed.
Yes.
So educating, giving education in terms of what to have in terms of snacking when the child start eating. So it's not about just having a dental pain to visit a dentist. No.
That's great. Now,
Whenever we go early,
yeah.
we prevent further complications in the future.
Okay, that sounds very, very clear and very, very great,
Mhm.
actually. But now the question is, how often do you advise the parents takes their children to the dentist?
In general, if the child is not at high caries risk, I recommend that they visit their dentist at least twice yearly.
Mm-hmm.
And this is generally in terms of like American or British guidelines. However, if the child is at high caries risk, by that I mean they have a previous experience of dental cavities, a previous extractions of some baby teeth or adult teeth, they have some medical issues, we categorize them as a high caries risk patient
Mm-hmm.
that should be seen every 3 months,
Mm-hmm.
not every 6 months. So 4 times yearly.
Okay, that's great. Now, we do have some myths in our society, and some people might take some speech from an official
Mhm.
and unofficial resources, like somebody that is not a medical professional or even not a dentist,
Mhm.
and they try to take these news or these myths or rumors and give them to their parents or to their
Mhm.
relatives. And they sometimes say that, if the baby is having a new tooth,
Mhm.
he will that will be related to the high temperature sometimes that happen. Is that right or not?
Well, uh, having a fever or temperature, sometimes in some children, that could have a link.
Mhm.
However, in studies and papers,
It's
it's
not
not
proved.
yes,
Yeah.
not supported
Mm.
to be honest. However, that from the clinical experience, from what I've noticed, mostly have high salivation,
Mhm.
and the child is not himself. He's not okay, crying more, putting their hands inside their mouths, which I always recommend the parents not to take the hands out, because whenever you have a pressure inside, this will help the eruption of teeth.
Yes.
So if they take the mother hand or the father or their hands inside, leave it. They're helping themselves. Or put something really cold, like for example, even a vegetable like carrots or a cucumber when it's really cold, and try to massage around the gum. This will ease the pain for them as well. Uh, Temperature, yes. Some cases I've noticed that the child will come with temperature, upset stomach. That could, but not really supported by evidence.
Okay, that's great.
Okay.
Now, sometimes with a fluoride use, if some dentists recommend the use of fluoride to keep the oral health,
We all do,
well, you
not
all
some.
do, yes, I know.
I
But
know.
sometimes the parents or the
They're
relative,
against.
especially the grandfathers and the grandmothers, they say there's a negative impact of using the fluoride in the children. Is that right or not?
In general, fluoride is really important for the child health well-being as well,
So for
because
overall health now we're asking.
overall, yes,
Okay.
because uh, unfortunately, I've been like listening to this myth a lot
Yeah.
recently, and to be honest, it's not really supported by a well evidence-based papers or documents. It's just like you can use, like you can find it on mommy's WhatsApps, or they're relying this linking it to autism spectrum, that if
Yes.
you give your child a toothpaste with a fluoride, you will have an autistic child, or you will cause autism to your child. This is unfortunately is just like a rumor.
And sometimes
Uh,
they give you a clarification, and also they give you a
no,
diagnosis. They say the fluoride might affect the glands in the body, and they give you a
I
full
always
medical
ask them,
history.
what's your resources?
Yes.
Is it evidence-based
No.
dentistry?
What's
Is
up?
it what? Yeah,
As usual.
WhatsApp or social media videos? Uh, Fluoride is everywhere.
Yeah.
If
And
you don't want fluoride, don't drink water. We have
yes,
fluoride in
definitely.
water. Don't eat fish. Don't walk on sands. Fluoride are all around us, and all the fluoride that we use is from. It's not artificial. It's from natural resources. So if you want to avoid it, then avoid everything.
Which is very difficult.
Exactly.
Okay.
And they really need it, because what I've noticed recently, when the parents are against fluoridated toothpaste, they will come to me like on the last reservoir, because all of the child teeth are cavitated,
Yes.
and then I have to put this child under general anesthesia to extract all of his teeth, because they think that fluoride is not important, and the child will be having cavities because they will eat candies, they will eat multiple things,
Yes.
and then when they have cavities, they're not getting the right resources. I'll consider it as a neglect, to be honest. I always spend time educating them, trying my best to show them the importance, but sometimes I cannot really change their beliefs. And I do respect and understand. However, my role as a pediatric dentist is to educate them,
Yes.
show them the reliable resources, and direct them.
Okay, that sounds very interesting. Now, I know the speech is getting very fast and we are getting to the end of our segment, but we do have two more questions if you don't mind.
Yes.
So the first one is, what are the measures you always advise the parents to take in order at least to prevent any problems that happens to the oral health to the children?
Well, overall, I always advise them, if the child is under the age of 3 years old, is to have a fluoridated toothpaste that contains at least 1000 ppm fluoride, and to brush their teeth twice daily, once in the morning and once before bedtime, which is very important. If the child is under 6 or 7 years old, they cannot really brush alone. If they want to, because they're used to the habit, I will allow them one time to brush, and then as a mommy, I will do it myself another time to make sure that I've cleaned everything. If the child is above the age of 3 to 6, or and above, they should have a toothpaste that contains fluoride 1350 up to 1450 or 1500 ppm. Brushing twice. They should visit their dentist twice yearly at least. I always recommend, to be honest, every 3 months, to have a balanced diet overall. And if they're brushing, to spit rather than rinsing in the morning. That's to make room more for fluoride on the teeth. Also, to avoid snacking on sugary snacks
Yes.
and restrict sugary intakes to meal times.
Okay, I know your pieces of advice is very valuable, but there is one more important point, which is the regular visit for the dentist. I
Yeah.
know it's very stressful for us, the adults, to visit the dentist in a regular way. So, how would you advise the parents to make the visit for the dentist for their children less stressful?
Well, I always, if they, for example, if I know that this child is coming to visit me and I know the mom or the father or whatever, I will always recommend them that they open, for example, now we all have social media,
Yes.
to open my Instagram account to show the child videos of me with the children. Sometimes the child, when they see other children visiting the dentist, and especially when they are the same age, like modeling group, they will have more power and courage to come. Also, now we have all YouTubes and internets. They can show them like videos of, for example, children the same age visiting a dentist. They can give them like flashcards about the dentist. They can do a role play at home. For example, the child is checking the mom with a plastic mirror. So this will help the child break the fear. And then, because we are all, we have fear of the unknown.
Now,
Wh-
the other side of the problem, actually, if the child or the children feel stressful going to the dentist, do you actually like struggle to deal with some kinds of child? I need the question to be either yes or no, and then we would complete in the next segment.
Sometimes, yes.
Sometimes, okay. We will have some stories from your clinic,
Yeah.
and we are very honorable today, actually, to have you. Hopefully, we
you.
can have you again to complete the discussion about the
Honor
pediatric
is mine.
dentistry and the importance of it. Thank you very much.
Welcome.
Our dear viewers, we have reached to the end of our segments of Medcast. Hopefully, we can see you again with another healthcare specialist. Until that time, goodbye.